Welcome to Nursing Prep. Push yourself in nursing preparation with smart way. Practice this quiz on www.thestudyblog.com. Fundamentals of nursing. A nurse is caring for a client who will perform fecal occult blood testing at home. Which of the following information should the nurse include when explaining the procedure to the client? Option A. Eating more protein is optimal prior to testing. Option B. One stool specimen is sufficient for testing. Option C. A red color changes indicates a positive test. Option D. The specimen cannot be contaminated with urine. Right answer is Option D. The specimen cannot be contaminated with urine. For fecal occult blood testing at home, the stool specimens cannot be contaminated with water or urine. Some proteins such as red meat, fish, and poultry can alter the test results. 3 specimens from 3 different bowel movements are required. A blue color indicates blood in the stool. A nurse is talking with a client who reports constipation. When the nurse discusses dietary changes that can help prevent constipation, which of the following foods should the nurse recommend? Option A. Macaroni and cheese. Option B. Fresh food and whole wheat toast. Option C. Rice pudding and ripe bananas. Option D. Roast chicken and white rice. Right answer is Option B. Fresh food and whole wheat toast. A high-fiber diet promotes normal bowel elimination. The choice of fruit and toast is the highest fiber option. Macaroni and cheese is a low-residue option that could actually worsen constipation. Rice pudding and ripe bananas are low-residue options that could actually worsen constipation. Roast chicken and white rice are low-residue options that could actually worsen constipation. While a nurse is administering a cleansing enema, the client reports abdominal cramping. Which of the following is the appropriate intervention? Option A. Have a client hold his breath briefly. Option B. Discontinue the fluid installation. Option C. Remind the client that cramping is common at this time. Option D. Lower the enema fluid container. Right answer is Option D. Lower the enema fluid container. To relieve the client's discomfort, the nurse should slow the rate of installation by reducing the height of the enema solution container. Taking slow, deep breaths is more therapeutic for easing discomfort than holding the breath. The nurse should stop the installation if the client's abdomen becomes rigid and distended or if the nurse notes bleeding from the rectum. Option C is not therapeutic as it implies that the client must tolerate the discomfort and that the nurse cannot or will not do anything to ease it. A client with chronic pulmonary disease has a bluish tinge around the lips. The nurse charts which term to most accurately describe the client's condition. Option A. Hypoxia. Option B. Hypoxemia. Option C. Dyspnea. Option D. Cyanosis. Right answer is Option D. Cyanosis. A bluish tinge to mucous membranes is called cyanosis. This is most accurate because it is what the nurse observes. The nurse can only observe signs/symptoms of hypoxia. More information is needed to validate this conclusion. Hypoxemia requires blood oxygenation saturation data to be confirmed and dyspnea is difficulty breathing. To prevent postoperative complications, Nurse Kim assists the client with coughing and deep breathing exercises. This is best accomplished by implementing which of the following? Option A. Coughing exercises 1 hour before meals and deep breathing 1 hour after meals. Option B. Forceful coughing as many times as tolerated. Option C. Huff coughing every 2 hours or as needed. Option D. Diaphragmatic and pursed lip breathing 5 to 10 times, 4 times a day. Right answer is Option C. Huff coughing every 2 hours or as needed. Huff coughing helps keep the airways open and secretions mobilized. Huff coughing is an alternative for clients who are unable to perform a normal forceful cough, such as postoperatively. Deep breathing and coughing should be performed at the same time. Only at meal times is not sufficient. Option 1. Extended forceful coughing fatigues the client, especially postoperatively. Option 2. Diaphragmatic and pursed lip breathing are techniques used for clients with obstructive airway disease. Option 4. Nurse is preparing to perform tracheostomy care. Prior to beginning the procedure, the nurse performs which action? Option A. Tells the client to raise 2 fingers to indicate pain or distress. Option B. Changes twill tape holding the tracheostomy in place. Option C. Cleans the incision site. Option D. Checks the tightness of the thighs and knot. Right answer is Option A. Tells the client to raise 2 fingers to indicate pain or distress. Prior to starting the procedure, it is important to develop a means of communication by which the client can express pain or discomfort. The twill tape is not changed until after performing tracheostomy care. Cleaning the incision should be done after cleaning the inner cannula. Checking the tightness of the ties and knot is done after applying new twill tape. Which action by the nurse represents proper nasopharyngeal/nasotracheal suctioning technique? Option A. Lubricate the suction catheter with petroleum jelly before and between insertion. Option B. Apply suction intermittently while inserting the suction catheter. Option C. Rotate the catheter while applying suction. Option D. Hyperoxygenate with 100% oxygen for 30 minutes before and after suctioning. Right answer is Option C. Rotate the catheter while applying suction. Rotating the catheter prevents pulling of tissue into the opening on the catheter tip and the side. Suction catheters may only be lubricated with water or water-soluble lubricant, and petroleum jelly such as Vaseline has an oil base. No suction should ever be applied while the catheter is being inserted because this can traumatize tissues. The client should be hyperoxygenated for only a few minutes before and after suctioning, and this is generally limited to clients who are intubated or have a tracheostomy. Which client statement informs the nurse that his teaching about the proper use of an incentive spirometer was effective? Option A. I should breathe out as fast and as hard as possible into the device. Option B. I should inhale slowly and steadily to keep the balls up. Option C. I should use the device 3 times a day, after meals. Option D. The entire device should be washed thoroughly in sudsy water once a week. Right answer is Option B. I should inhale slowly and steadily to keep the balls up. Proper use of an SMI requires the client to take slow, steady inhalations, every hour or two, 5 to 10 reps each time. Only the mouthpiece can be successfully rinsed or wiped clean. The device should not be submerged in water. Option 4. While a client with chest tubes is ambulating, the connection between the tube and the water seal dislodges. Which action by Nurse Flora is most appropriate? Option A. Assist the client to ambulate back to bed. Option B. Reconnect to the tube to the water seal. Option C. Assess the client's lung sounds with a stethoscope. Option D. Have the client cough forcibly several times. Right answer is Option B. Reconnect to the tube to the water seal. The tube should be reconnected to the water seal as quickly as possible. Assisting the client back to bed and assessing the client's lung are possible actions after the system is reconnected. Nurse Peter makes the assessment that which client has the greatest risk for a problem with the transport of oxygen from the lungs to the tissues. A client who has Option A. Anemia. Option B. An infection. Option C. A fractured rib. Option D. A tumor of the medulla. Right answer is Option A. Anemia. Anemia is a condition of decreased red blood cells and decreased hemoglobin. Hemoglobin is how the oxygen molecules are transported to the tissues. Would depend on where the infection is located. A fractured rib would interrupt transport of oxygen from the atmosphere to the airways. Damage to the medulla would interfere with neural stimulation of the respiratory system. Thanks for watching. You can also practice this quiz on www.thestudyblog.com, link in description box. If you have any doubt, ask in comment section, and you like our video, then do like, comment, share. Subscribe our channel for regular updates.